Myself, Dr. Vikas Jaiswal, working as an assistant professor in a department of veterinary pathology, College of Veterinary and Animal Sciences, Sardar Vallabhbhai Patel, University of Agriculture and Technology, Modipuram, Meerut. Friends, today we are going to discuss a very important topic, how to set up a diagnostic histopathology diagnostic lab. So, in this topic, we'll discuss about what are the guidelines, what are the requirements, what are different sections, and what is the need and application of this technique. So, and who are the clients, what are the strategy of sales and marketing of this technique. So, to develop as an entrepreneurial opportunity. So, friends, today we are going to start with histopathology diagnosis lab, how to set up a histopathology diagnostic lab. Today we are going to discuss how to set up a histopathology lab. Topic of my presentation is starting a histopathology lab, a step-by-step guide for aspiring entrepreneurs. The topic has been covered under subheadings histopathology. What is histopathology? What are its applications? What is need of this technique? And what are the various sections or units which we have to make, and what are the requirements of particular section, who are the clients, and what is the strategy of sales and marketing. So coming to first, what is histopathology? So the histopathology is divided into two words, histo and pathology. Histo means histology, tissue, a normal tissue, the orientation of cell and its adjoining structures such as stroma and protein. So these all normal structures comes under histology. So if there is a deviation from this normal structure, then it comes under pathology. So suppose there is a increase in cell size, decrease in cell size, and there is a deformity in some nucleus, or there is an infiltration of cells. So these all things come under pathology. So histopathology is making diagnosis by the examination of cellular tissue details in tissue sections under microscope. Coming to its application and need. So first and foremost is biopsy examination. Friends, you will astonish to know that 70% of tumor diagnosis is rely on biopsy examination. Next is the histopathology of post-mortem tissue. When we conduct any post-mortem, whether it is from infectious disease or it has been conducted by the pharma industry personals in research sector, so we have to conduct post-mortem examination, and after that the tissues, various tissues, lung, liver, kidney, heart, spleen, etc. are collected. So histopathology, to know the cellular injury or cellular details, we have to go for histopathology examination. So third one is immunohistochemistry. So this is a actually advanced application of histopathology, and in which we pinpoint the antigen. So these all histopathological techniques, they are meant for disease diagnosis, and second one is disease prognosis. Means how our treatment, how the clinician treatment is responding, whether it is going for in normal direction or in negative direction. So these all we can know by doing the histopathology. Third one is neoplastic detection, staging, and grading of the tumor, which can be done by the histopathology examination. Friends, there is a lot of scope, there is a lot of demand from clinician side, industry persons, and various other sectors of this histopathology technique from various corners of our country. But there is a hardly any you can find any laboratory, especially private laboratory in your area. So these all clinicians, they send their samples to the metro cities such as Delhi and Bombay for the diagnosis. So there is a lot of scope because of lack of this common facility. Coming to sections or units, so there are 6 basic units to open up or to set up the histopathology lab. First one is tissue collection and fixation unit. Second one is tissue processing unit. Third one is sectioning unit. Fourth one is staining unit. Fifth one is viewing and diagnosing. Sixth one is record keeping and storage unit. So coming to first, tissue collection and fixation. Whenever tissue comes to your laboratory, it will generally comes in 100 ml plastic bottle. So first we have to look at the label, whether it is properly labeled or not. Then we have to take entry of this label in our register, and then we should code the sample, and then we should open up the container, and we have to look after the tissue whether it is what is the thickness of tissue. So if it is more than zero point 0.5 centimeter or 5 millimeter, it is not advisable, so we have to cut into pieces. So for the fixation, generally tissue comes fixed tissue comes to you. If it is not, you have to fix the tissue by using 10% of neutral buffered formalin. Generally, the tissue 5 millimeter tissue will fix in 48 to 72 hours, and if biopsy tissue is there, it can be fixed within 24 hours. So I have given the recipe of this 10% neutral buffer formalin. You will have to add 100 ml of formaldehyde, 4 gram of sodium dihydrogen orthophosphate, 6.5 gram of disodium hydrogen orthophosphate, and 900 ml of distilled water to make 1000 ml of 10% neutral buffered formalin. It is an excellent fixative. Other than this, it caters most of the need of most of the type of histological staining. But in case of special staining, suppose you want to stain uric acid, then the tissue will be fixed in 95 or 100% ethanol. Coming to tissue processing. So for the tissue processing, you can process the tissue manually or you can process the tissue by machine. Both give similar results. For manual processing, you will only require 10 wide mouth bottles of 1 liter, as you are seeing in the picture, and the chemicals requirement is ethanol, distilled water, acetone, benzene, xylene, and paraffin wax. So what we have to do before processing the sample, we have to cut the tissue, we have to put the tissue into tissue cassettes, and then we have to wash at least 1 to 2 hours. Then we have to dehydrate this tissue. So we have to put this capsule and in the graded dose of alcohol. So for dehydrating, we start from 70%, then 80%, 90% alcohol, then absolute alcohol 1 and absolute alcohol 2. So it will be properly dehydrated, and further it is further dehydrated by putting this tissue in 2 changes of acetone. Then we have to put this tissue in benzene. So we have to give two changes of benzene. If you are not having benzene, you can use xylene also. So this is a manual process. Same chemicals are required for machine processing. So the machine which has been used is a automatic tissue processor. The process is same, but we have to program it, and we have to program it by the time and the temperature. Those same chemicals are required in this machine also. So there are in the market you will get two types of machine. One is without vacuum and second one is with vacuum. The advantage of with vacuum machine is you will not be exposed to this injurious or these chemicals such as benzene and acetone. And if you are not using this vacuum machine, then you will essentially use the exhaust fan. So exhaust fan is very much necessary for tissue processing. If you are processing your tissue without vacuum machine, or you are processing by the manual method. So after putting the tissue in benzene, what we have to do, we have to we have to make a block of that tissue. So for making block, first we have to give 2 changes of paraffin wax. So there is requirement of 2 types of paraffin. First is having melting point of melting temperature of 58 to 60 degree, and second one is 60 to 62 degree centigrade. So what is happening? This first one, 58 to 60 degree, it will provide more of the penetration, and the 60 to 62 degree melting point will give hardness to the tissue. So we'll put this cassette in this paraffin wax for 3 hours, 2.5 to 3 hours in paraffin 1, that is 58 to 60 degree, and 2.5 to 3 hours in paraffin 2, that is 60 to 62 degrees centigrade. So after putting this tissue, we have to make the block. If you are having ample amount of money, then you can buy automatic dispenser or a tissue embedding machine. So it is having a nozzle from which the liquid paraffin is automatically get poured and the blocks are made very easily. But if you are not having that much of money, you can make blocks by manual method by using these L blocks. You can pour directly the paraffin wax, but you have to melt that paraffin wax in the incubator. So you are only in the requirement of incubator. Now, after the block has been made, so we have to make the sections, tissue sections. For making this tissue sections, we have to use a machine. It is known as microtome or rotatory microtome. So, in the market, you will get three types of microtomes. First one is manual or conventional microtome. Second one is semi-automatic microtome, and third one is fully automatic microtome. So this actually it is the manual rotatory microtome, which is a conventional microtome. It is a very cheap. It will cost around 30 to 40,000. But if you go for this semi-automatic and automatic machine, it will cost around 7 to 10 lakhs. So when you have to put this block in the microtome machine, and you have to cut the tissue in tissue sections, thin sections. So we generally used to cut the tissue at the level of 5 micrometer, 5 micron. So when you cut this tissue, you will also need the microtome blade also. So you have to use a good quality of blade, microtome blade. It is a very necessary. So you will get a strip of tissue in the paraffin wax. So you put this strip in the water bath, hot water bath. So what will happen? This tissue will spread in the hot water bath, and then you will take a slide and take this tissue section on the slide, and you can put this tissue for 5 to 10 minutes on heating plate having temperature 60 to 62 degrees centigrade. After putting this tissue on heating plate, you put this section of the glass slide, and these glass slides are incubated at 62 degrees centigrade in the incubator for further fixing. So this is up to this step we have not stained the tissue. So our tissue is there, a section is there, but it is not stained and it is not visible. To visualize this tissue, we have to go for staining. Similar to the processing, staining technique is also applied. So for the staining, there are two methods. One is manual method and second one is machine method. Both methods are equally good, but the thing is machine method is very costly and it requires a lot of chemicals, and this machine is also costing very high, from starting from 7 lakhs to go up to 44 lakhs, depend on make and model and the company of this processor. So first I am discussing the manual method of staining. So most common staining which is used for histopathology is hematoxylin and eosin. We know that every cell is having a nucleus and cytoplasm. Cytoplasm is a basic and nucleus is acidic. So acidic component is it is stained by the basic dyes such as hematoxylin, and cytoplasm, which is a basic, it can be stained by the acidic dyes such as eosin. So we are using combination of these two, so you will get a good contrast of the cell, and you can easily view under the cell. You can see the cells, what are the deformities, whether its size is increased, nucleus size increased, all these things you can visualize easily. So for routine staining, as I have said earlier, hematoxylin eosin stain is most popular stain. So for manual method, you require only 18 bottles of 1 liter or 500 ml, at least 15 bottles, and coupling jar. Coupling jar you can use glass coupling jar you can use. And the third thing what you require is DPX mountain or cedar wood mountain. So what will happen? You have to now stain for staining this tissue section. First, you have to remove the uh, paraffin. So for removing the paraffin, you need to have some uh, organic solvent. So we are using xylene. So we give two changes of xylene. So we have to pour xylene, or you have to put or immerse the slide in xylene for 10 minutes in each. After that, we have to hydrate the tissue because we are using the stain aqueous stain. So our tissue or section should be at the aqueous level. So for rehydration, we have to use graded dose of alcohol. So first we are absolute alcohol, then we have to put the slide in 90%, 80%, 70%, 50%, and then in tap water. So now our slide is in aqueous medium and it is ready to be stained by the aqueous stains. So we have to apply now hematoxylin for 10 minutes, then again wash. Then we have to use 1% acid alcohol to remove the extra hematoxylin. Then to compensate or to neutralize this acid, we have to use ammonia water. All these things we can use for one minute or quick dip. And after that we have to wash and we have to apply the second stain, that is eosin, which will stain the cytoplasm. Now we have to wash the section, and now our slide is ready for the uh, dehydration. So we have to dehydrate the tissue for making it permanent. So now again we will dehydrate the tissue by giving the graded dose of alcohol. First 50, 70, 80%, 90% absolute alcohol 1 and absolute alcohol 2. And then now our tissue is properly dehydrated. Now we have to put this tissue section in the xylene because for clearing the tissue. And after this xylene, we have to put the cover slip by applying some DPX, or you can use Canada balsam instead of DPX. So, and you put the slide for 1 day, and after 1 day you will get in open air at room temperature. So it will be properly fixed, and now our slide is permanently mount, and it is having a very high life such as 10 years, 20 years, like that. So you can see the rightmost image of stain slide, and if you weave the you will see the cells as you have as it is seen in rightmost corner. Now again, this is automatic. You are seeing now automatic tissue section staining machine. So this machine is very costly, I have said earlier, but it gives similar results as if the manual method. Now special staining. So most commonly we are using HME, but special stains are also available for staining various different types of tissue and different purpose. Suppose I have put some of the stainings such as Mason's trichome. It can stain the fibrous connective tissue especially. And the second one is acid fast stain. You can use this acid fast stain on tissue sections for demonstrating the tuberculosis or other tuberculoid bacillus or cryptosporidium. So these can be stained by acid fast stain. You can use toluidine blue. Toluidine blue can stain a particular tumor known as mast cell tumor. So for making a diagnosis of mast cell tumor, you can use the toluidine blue. Another stain is very popular is methyl green pyronine. This stain can differentiate between RNA and DNA. Suppose one individual is affected with DNA virus and another one is infected with RNA virus. So how to differentiate? So a tentative diagnosis can be made by using this methyl green pyronine. Another stain is periodic acid sip. It can stain the fungal hyphae. Now coming to advanced staining procedure. So now it comes to immunohistochemistry. Actually, immunohistochemistry is an advanced application of histopathology only. As the name suggests, immunohistochemistry. Immuno means the antigen, the immune bodies, that is antibodies. So this is an amalgamation of two techniques, that is a immunology and histochemistry. So this technique is more or less similar with the histopathology with addition of some of the steps. What are the steps? In this immunohistochemistry, we cannot use normal glass slides. We have to use only positively charged or positively coated slides. You can charge also, and ready-made slides are also available in the market, positively charged slide, but they are a bit costly. And second one is we have to use antigen retrieval solution. When we put our tissue in the formalin for fixation, what is happening? It causes masking of the antigen. So we have to expose the antigen so that our antibody can stick to that. So for that we have to use antigen retrieval solution. So after that, we have to put primary antibody. Primary antibody is against the antigen or our point of interest, which can be some infectious agent such as coronavirus, rotavirus, or any other bacteria or virus. Or it can be non-infectious things such as in tumor diagnosis, we target the cellular components for the diagnosis. So after applying the primary antibody, we use generally secondary antibody. Secondary antibody is tagged with some enzymes. So after applying the secondary antibody, we have to apply the substrate for that enzyme. So this enzyme get cleaved by the substrate get cleaved by the enzymes which are present on the secondary antibody. So between all these steps, you will require phosphate buffer saline PBS, which is having PS 7.2 to 7.4 with twin 20. Twin 20 is act as a to remove the surfactant. It is actually a detergent only. So these are the things which are required for immunohistochemistry. Immunohistochemistry is nowadays, it is an emerging and fascinating branch, especially in case of human pathology, and it is also applied in veterinary pathology a little bit. So after you have made the slides, now coming to diagnosis part. For diagnosis, you have to weave that slide. For weaving, you need to have a good microscope, binocular microscope. And essentially, you will have to have a camera, photographic camera attachment, so that you can send these pictures for diagnosis if you're not able to diagnose. So I think this binocular microscope with camera photographic attachment is very must. If you are having very advanced histopathology lab, so you have some of the diseases such as rabies, we are using generally fluorescent antibody testing. And for this fluorescent antibody testing, we need to have a fluorescent microscope. But it is a very costly, it comes around 7 to 20 lakhs depending on make and model. So it is used generally in very sophisticated labs. But for conventional histopathology, this binocular microscope with photographic attachment is sufficient. Now coming to record keeping and storage unit. Now record keeping is very important. We have to make archive of our tissue and these blocks. So first of all is most important is data entry and record keeping. We have to make a table in which we have to first enter the serial number, date of receiving the sample, name or and address of the owner, type of the tissue, such as liver, lung, kidney, heart, spleen, brain, skin, anything what we they have provided you. And fifth one is history of the. A brief history is also required. It will help to make a diagnosis, especially in case of tumors, which from which part the tissue has been taken. It is a very important. It will help with the pathologist to diagnose the tumor. And sixth one is a code. you should also provide a code to your sample, because you cannot write all the things on the blocks. So you provide some code which will reflect on your block. And seventh one is result and diagnosis. What is the result? A tentative result or a result has been drawn by the pathologist. And the last one is signature of diagnosing officer. So we have to make a register, and we have to make a record of all these things. It is very necessary. Now you have completed all the process. So you don't have to throw the blocks, because these blocks are very important. We have to make archive of these specimen tissue blocks. So as you can see in the picture, we have collected annually or monthly these blocks, and we don't have to throw it. And next is storage of slides. So for this you need to have a slide cabinet. Actually, whenever you are cutting the slide, what we are doing, we are just cutting the slides in three sections. First one is stained for histopathology, and last two slides, second and third slides, are kept as it is, unstained, because most of the times or some of the times the clinician wants some other stain to be applied, or some specific things which have to be done with these slides, such as acid fast staining or anything else such as toluidine blue staining. So that can be done. So you need not to have repeat the process again. So I think we have to cut these sections, two extra sections other than first, which has been used for HNE staining. Now coming to clients, sales and marketing. Who are the clients? So it is very important who are the clients. So for clients, there's a pet hospitals. In this, clinicians are there. They can be our clients. Second one is veterinary and human clinicians. So this is the beauty of this technique, that histopathology is same. Whether you are applying in case of veterinary pathology or human pathology, the procedure is totally same. And these veterinary and human clinicians are in regular need of these histopathology techniques or pathological diagnosis. Uh, Now next is a contract research organization. What is contract research organization? So friends, these contract research organizations are very important, and they come up in within in last 10 years. They are coming up very much. What is happening in every pharma industry, they want their things or their drugs to be tested for safety testing or for big drug discovery, but they don't want to indulge this all tedious process again and again. And this histopathology process, as you have seen, so many steps are involved in this histopathology. So these pharmaceutical companies, they want some third party, so these third party who can do the histopathology for them. So this is a chance for us to develop a histopathology lab, so we can get regularly samples from them. And they are doing thousands of they are sacrificing thousands of rats, hundreds of rats every month. So you can get a lot of money from CROs. Another one is pharma industry or drug development. We know that for drug development, they are first tested, and the trial is done on the mice, rat, and some other animals. And after this trial, these animals are sacrificed, and the tissue are collected from these animals, and these tissue are cut into sections, and to study the alterations or the pathology which is involved at cellular level, whether that drug is affecting the cellular component or not, or what extent this is acting. So these all study is performed in case of drug development. So the pathologist, they wants histopathology for this drug development. So these pharmaceutical industries, especially small scale pharmaceutical industries, they can be our client. because large pharmaceutical industries, they are having their own R&D unit, but small pharmaceutical industries, they don't have their R&D unit, but because of compulsion of government, they want their safety trials to be done. So this is a very important branch, and from there we can get these samples. Now again, another is pathological and histological slides for sales, for direct sales, for museum. You know that in many colleges, in medical colleges, in normal colleges, uh, the faculty is regular need of some slides, some specific pathological conditions, some normal histological slides. So if you are preparing these slides, normal histological slides or pathological slides, you can sell it to for their museum, and they can give money, and which is a very costly actually. Persons are selling thousands, 5,000 per slide. They are charging for these specific pathological condition slides. So this can be they can be our clients. Now another one is research scholars. Friends, you know that around you many of the colleges like pharma colleges and medical colleges, they are doing research work, and their research work is either on animal tissue, or in agriculture sector also they want tissue sections, and same technique is applied there also. So these research scholars can be our client, because this histopathology technique is not available in everywhere. So uh, at the end, I will conclude that first and foremost is there is a regular demand. There is a regular demand of this histopathological diagnosis from every corner of our country. And second one is that there is a lack of facility in most part of our country. So demand is very much, but supply is very less. So this creates the uh, opportunity to us to create and as a and to be develop as a entrepreneur. So third one is, if you go for manual option, there is a very much less requirement of money. So you need not to spend much, but you can gain much. If you are if you are going for automated tissue processing, then the cost is more, but if you are going for manual method, the cost is very less. Most of the chemicals which are used in the histopathology are very cheap. So this is a very cheap technique. And fourth most is a very less space is required. So you need not to worry for space. You can open a histopathology lab in one or two rooms, provided ventilation is proper and exhaust is there. So that's all I think is histopathology. Thank you. So friends, in conclusion, I could say that there is a very wide, very much demand of this histopathological diagnostic techniques from all the parts of our country. Every clinician want diagnosis, histopathological diagnosis, but what is happening? There is non-availability of this facility. So first, there is a very much high demand of this histopathological technique. Second one is there is lack of facility of histopathology in and around you, and it is only available in metros. So what is happening? The clinician is sending sample to Delhi or to Bombay or to some other metro cities. So there is a very much demand and very less supply. So we are having a gap. So we have to take opportunity, and we have to grab this opportunity by setting up a histopathology lab. Third thing is very, if you go for manual option, very much less expenditure is required to get more and more benefit. Fourth one is very less space is required to start this technique or histopathological diagnostic techniques. So friends, I think this technique is very important, to be act as a opportunity for entrepreneur. Thank you.